Hey guys, welcome to Pathophysiology for Nursing Midterm Review. I'm Dr. Rutledge and I'm going to provide you a review for both my class and for Jennifer Howard's class. We cover the same content and the exams cover the same content, so you'll be covered. The questions, there are 50, multiple choice, but some will have multiple answers. So you'll have to answer 1 and 2, 1, 2, 3, 4, that kind of thing. And I'll kind of try to point that out on some of the questions that I go over. So you're going to have this audio, which is going to be turned into a video. This is the only screen you'll have the picture on. The rest of it's just going to be audio so that you can play it on YouTube anywhere. So bring your ID with you. It can be a driver's license as long as it's valid, it's not expired, a pencil and a Scantron, and you've all received announcements as to where to come, what room, and all that stuff. If you have questions, contact your instructor. You can look at this, watch this video, or you can just complete the Word document. It's up to you, strictly how you study for this exam. Good luck. All right, we're going to jump right into the review. So there are a lot of terms that you need to know. Some of the terms you need to know more than just the definition, but a little bit more about them, and I'm going to try to provide that for you either in this audio recording or in your Word document. So of course the term pathophysiology, you're going to have to know that because that's what this whole course is about. So on page 1 in your text, it gives you the textbook definition. So for your notes, write the textbook definition, but then take some time and put it in your own words so that you can understand. Sometimes the textbook definition is not that understandable. So I like to say that if anatomy and physiology is normal structure and function, then pathophysiology is abnormal structure or function caused by the disease process. Something like that. So here's some other words that I want you to know. So cell injury or death. How does this occur? All right, so here's what you're going to need to look for. You're going to look, hang on, let me find my page. Okay, turn to page 9. This is not necessarily in order as far as the terms or even the content, so it may jump around a little. That's why I kind of try to help you with page numbers. So let's look at the cause of cell injury or death. On page 9, it's the heading says cell damage and necrosis. So on the second half of the page to your right, it says there are many ways of injuring cells in the body, and it includes some terms and some methods of damage. So you need to know what ischemia means. It's a decreased supply of oxygenated blood to that tissue or organ due to some type of circulatory obstruction. But then there's also others. So this is what I mean by multiple responses is it's not going to ask you, does cell injury, is it caused by ischemia? Or it's not going to give you just one answer. You're going to have multiple answers that are correct that you'll have to choose. Some other causes would be in the next bullet, physical agents like excessive heat or cold, radiation exposure. The next bullet, pressure or tearing of the tissue. The next bullet is chemical toxins. The next bullet is microorganisms, bacteria, virus, parasites. So all these you need to know that they can all cause injury or death in some way or another. But then also when you look on down where it says decreased oxygen in the tissue can occur locally because of blocked artery or systemically because of respiratory impairment. And we know that our organs such as your brain, heart, kidneys, these are very high demand oxygenated areas, and they are affected very quickly by hypoxia, which is a reduced oxygen in the tissue. So altogether, you need to know the terminology, ischemia, necrosis, hypoxia, and how those affect cell injury or death. All right, like I said, a lot of these are out of order. They're not exactly in the same order, or maybe you're going to find these terms in multiple places in your textbook. Let's look at, this is just a different way for you to start looking at terms and trying to see what method works best for you to remember this stuff. So with leukopenia, draw a picture or write a term in these boxes above the word, the term, and try to understand these. These are your basis for your nursing career. You have to know what leukopenia is. And I have in your Word document that you can look on page 107, 194, and 550. But here's the type of question you're going to get. And you have to know all the terms in order to get the right answer, right? So a term used to describe a deficit of all types of blood cells. You have to know which one means that. So I'm going to let you look those up yourself because I can tell you and you're not going to remember them very likely. But in the box, write in your own term, in your own words, maybe a picture, maybe an example. You would find this pancytopenia in what type of disease or disorder. And that's going to help you to make those connections that you need to make. Here's some extra ones that you can add terms to as well. Here's another way of looking at some terms. If you guys are interested in Pinterest, they have a lot of different ideas on pictorial ways to learn diseases and disorders. Sometimes we'll put some of those links up in Canvas, but just search your Pinterest if you do that and look at any term, any disease process that you want to study. But for this, I don't think that these terms are going to be on this midterm exam, but they might be on the final. Just go ahead and look them up real quickly. Write them down, give some examples so that it's not just a term and a short little definition. Write something substantive there that you can understand and differentiate between these terms. All right, like I said, these are not in order by any chance. But let's look at neutrophils. I want you to look on page 116. There's a table. I really like tables and graphs. And if you're a visual learner, you can put anything in a graph, use your computer and put it in a table. Make your own table and do it similar to the table on 116, table 7.1. Put to the very left whatever the term or the disease process that you want to talk about, and then make columns for how does it affect the body, what exactly is it. So look at this table on 116. The one term I want you to look at is neutrophils. Here it says they're white blood cells for phagocytosis. So if you don't know what phagocytosis is, you have to go back and look that up as well. I think of phagocytosis as the little Pac-Man that eat, and some of you are too young to remember Pac-Man, but the little things that will eat the bacteria. So it's a non-specific defense, and it is active in the inflammatory process. Those are some things that you need to know. And then look and see when would these be elevated. Kind of look through your content here and see what it says. As far as some of these other terms, you're going to need to know what all of these terms are in order to choose the correct answer on the exam. All right, we're going to move on to chapter 2. So an important concept that you need to understand is osmotic pressure. How, if it's elevated above normal, what would happen to blood as far as the cells go. But in order to understand this, you have to know some more terminology. So osmotic pressure versus hydrostatic pressure. You also need to know what capillary permeability is in order to understand this. For osmotic pressure, we just think of it as a pulling force, with a hydrostatic being a pushing force. And these terms will help you also to understand what is the general cause of edema. Look at page 18 and 19. After you kind of get, see, I've gone back again, so I have to go back in my book. Page 18 and 19. All right, so think of this as a 4-part answer, and it's pretty much spelled out for you. Excuse me. Causes of edema on page 18. This is the big heading. So First, there's an increased capillary hydrostatic pressure. I can't talk today. And we're going to remember that hydrostatic is a pushing force. Remember, this is going to prevent return of fluid from the interstitial compartment to the venous into the capillary. So excessive fluid is pushed out of the capillaries into the tissue. Excuse me. So the second one, there's maybe from loss of plasma proteins. The third one, it can be from some obstruction in the lymph circulation. And then the fourth one is increased capillary permeability. So we kind of have to know what the general causes are so that you can choose the correct answer and you know what the general causes are not. But the key is to understand hydrostatic versus osmotic pressure and capillary permeability when it comes to edema and how it all happens. Also, page 21, it just goes right into a couple of pages over, third spacing. So you understand how you have to understand the basic concepts in order to understand a more complicated, such as third spacing. Give an example of when you would see this in a disease or an injury. And go a little bit farther. What would hematocrit reading look like? If somebody, you have to understand what third spacing is. Third spacing is the fact that you have the same amount of blood in the body cavity. You have the same amount of fluids. They're just not in the vasculature. So think about diluted Kool-Aid. Some people like their Kool-Aid really strong and they put less water, right? So it's the same amount of the powder, but it's either diluted because we added more fluid or it's concentrated because we haven't added as much. So think of what your hematocrit reading would look like if your blood volume is either diluted or increased in fluid. All right, moving on to chapter 4. What is the gate control theory and how does it work? I'm talking about like in the brain. How do the impulses work to tell you that there is pain or to block pain? And then I need you to go and look up the differences in pain. You have chronic pain, someone that has an old back injury. You have central pain. You have cardiovascular pain. That would be someone that's having angina from exercising. They have cardiovascular disease. Ischemic pain is more like a heart attack. Know what the difference is. What would signs and symptoms of each be? And then in order to answer these questions, you need to know what is the pain threshold. Is everybody's the same? What is referred pain? What is phantom pain? And pain tolerance. Again, is everybody's pain tolerance the same? All right, on to chapter 5. Inflammation is going to be in several chapters, so you have to know the physiology, you have to know the definition, the causes, acute versus local or systemic, and how does the blood react to inflammation. Look at that on page 72. Start on 67, but like I said, it's all through the text. So let's look specifically at the inflammatory response, and I want you to look at page 69, table 5.1 at the bottom, chemical mediators in the inflammatory response. So, in order to understand this concept, you have to know what the chemical is, and not so much what their source is, but kind of the action. So we need to know that histamine is a chemical mediator in the inflammatory response. There's immediate vasodilation from this, increased capillary permeability. You need to know that prostaglandins are a chemical mediator. Both of these that I've just talked about originate from mast cells, but the mast cell would not be the chemical mediator itself. So the prostaglandins also, vasodilation, increased capillary permeability, pain, fever. So start understanding, is pain and fever, are those local or systemic responses. Get those straight, because you're going to have those kind of questions all throughout. But the main thing is that it's histamine and prostaglandins, leukotrienes, kinines. These are the chemical mediators, but the source is different. Okay, the mast cells are different. They're a source. The macrophages are a source. So try to keep separate, like in the table, the chemical versus the source, where it came from, and its action. How do we treat it? Look at page 75. I know you've all heard of this one because a lot of us have kids or brothers and sisters that have, my handwriting's horrible with this pen, sorry. We've done this a million times. Rice. Look that up. Everybody gets it when you have inflammation, especially if you've got a strain or a possible fracture. All right, let's look at chapter 6. What is a virus? So you have to know what it is to know how it replicates. You have to know what it is and how it replicates to know how we treat it. Do we treat a virus with an antibiotic? Like, no, the flu, a lot of times you'll see doctors give an antibiotic, and that's usually just to prevent a secondary infection. Someone with asthma has got a very high risk for developing pneumonia, and they'll start that just to prevent that secondary infection. Let's look at page 109. Antiviral agents. They decrease the reproduction of the virus inside the host cell or prevent its attachment into a cell. It cannot destroy the actual virus. And then I want you to look, and this is a good place to look in every chapter. You look at the chapter summary. So for this is page 112. This has some really good information on it. It says that a virus is an intracellular parasite. It requires a living host cell for reproduction. It contains either DNA or RNA. They cause disease by destroying human cells during replication or by altering the human cell DNA. Also, it has a good bit on resident or normal flora. That is something that you need to know, and I'm not sure if I have it on your Word document. So be sure and add that, normal flora. Again, systemic versus local. Get that down. What is local? Redness, itching. What is systemic? Fever, that kind of thing. So get those things down for you. All right, let's go to chapter 7, immunity. You can look up the thymus gland functions, but I want you to look at how the following cells work in the immune response. Again, page 115. You're going to have the cells, right? Also, I want you to read 115, the bottom there where it says cells, all through 118, because it has all of these there. But I really want you to look at table 7.1 again, 7.1 on page 116, because it has them in a condensed version. Condensed is always good, because I didn't always get all my deals there. So let's look at table 7.1. Eosinophils, what are they? They're white blood cells. They participate in allergic responses and defenses against a parasite. Doesn't sound like an initial step in an immune response to me. Monocytes. Here's monocytes. White blood cells migrate from the blood into the tissue to become macrophages. What is the macrophage? Macrophage is responsible for phagocytosis. Again, you have to know what that means. That process and presents antigens to lymphocytes for the immune response. And then helper T cells, it says they activate B and T cells to control or limit specific immune responses. So to answer this question, what is the initial step? Go back to page 115. And under cells, it says the macrophage is critical in the initiation of the immune response. They develop from monocytes. They occur throughout the body in such tissues as liver, lungs, and lymph. They're large phagocytic cells that intercept and engulf foreign material and then process and display the antigens from the foreign material on their cell membrane. So that would answer that question, and that would be macrophages. So that's how I want you to look at things, look at definitions, but also look at examples, look at how they work, what is their response, what is their job in whatever it is we're talking about. Look on in chapter 7, systemic lupus. I didn't put the page number, but it's in chapter 7. Look at the different types of immunity. Another table. You know I like tables a lot. All right, so table 7.3. Different types of immunity. Give examples of how you would receive each type of immunity. All right, so before you come into the nursing program, you're going to have to provide proof of immunizations, that all your immunizations, especially your Hep B, is current. So tell me which one of these types of acquired immunity would you consider a nursing student to have that has to provide that from immunizations? Let's look at it and see. Natural active, the pathogen enters into the body and antibodies form. That would be, I had chickenpox as an adult, actually. I had mumps as a kid. I should have antibodies to that. Artificial active, a vaccine, live or attenuated, is injected into the person. No illness results, but antibodies form. That would be our immunizations that you have to come into nursing school. Natural passive, antibodies pass directly from mother to child. It's temporary. And then artificial passive, antibodies injected into the person to provide temporary protection. And this would be like a gamma globulin. If you have been exposed to a needle stick and it's high risk, then they would give you that. So know the different types. Have some examples there, okay? All right, let's move on to chapter 8. What are characteristics of the epidermis, dermis, subcutaneous tissue? What's the differences in them? Look at page 143, and there is a figure 8.1, and there's a diagram of the skin. So look at those to see. There's the epidermis, the dermis, and then the subcutaneous tissue. What's subcutaneous mean? Is it the same thing as fat? Yes, it's the same term. So look at the differences in those. What is in the rest of them that I don't see in, say, the epidermis? I don't see any kind of vessels, do I? But then once we get to the dermis and then to the subcutaneous tissue, there's going to be a difference in each one of those. Look at skin conditions. What is scabies? Where would you find that? Where is impetigo? What would it look like? Pediculosis humanus corporis. That's a big word for head lice, right? Seborrheic keratosis. What are they? Where do you find them? What would be characteristic to go, oop, that person has scabies, or that person has head lice? And then here's your normal flora, and again, I saw that in a different chapter as well. Moving on along, chapter 9, page 167. There are bulleted definitions of different ones. What's open versus closed? An open or compound fracture is when the skin is broken. You may have fragments protruding. It can cause more damage than just a clean, simple fracture. So look at the different terminology. Is it simple? Is it segmental? Is it impacted? Is it pathologic? Sometimes it's pathologic when we have an old person with osteoporosis and they fall and they have a broken hip. But a lot of times it's not that they fell and broke their hip, but their hip broke and it made them fall. So know the differences between these things. Colles fracture. And then skip on to page 175. What are the characteristics of Duchenne's muscular dystrophy? Page 176, osteoarthritis. How does it affect healthy joints? What are the characteristics of this disorder? All right, chapter 10, blood and circulatory system disorders. Look at page 186, 187, 188. Know what is this major action, right? You're going to see this a lot when you get into the nursing program. You're going to do red blood cells. What do they do? What do white blood cells do? What is their importance in the system? So we know that blood provides our transport system for oxygen, glucose, and other nutrients. We know that it provides homeostasis. It provides a mechanism to control body temperature. Let's look at the composition, the next page. We know that, let's look at hematocrit right underneath that. That's the proportion of cells, they're erythrocytes, in the blood and indicates the viscosity of the blood. We know that males typically have a higher hematocrit than females. An elevated hematocrit could indicate dehydration. Remember the Kool-Aid thing, we are either concentrated or diluted, or excess red blood cells. A low hematocrit might result from blood loss or anemia. So look at what something is. What is it a smaller, or a bigger proportion of? What is its action? What's its purpose? And then what would happen if it's elevated or reduced? What would we call it, and what would it look like? What would it be caused from? Then move on, page 194. That is only one there. Figure 10.1. Who is a universal donor in regards to blood types? Why? What are the blood types? Why are they different? What is that plus or minus that is, let me find this page, that is behind your blood type? On page 200, look at sickle cell anemia, the characteristics, the causes. Severe anemia, blood transfusion reactions. What are you going to see if someone's having that, and why would they have that? And then what's the role of vitamin K in the liver? Again, sometimes you can find some of this stuff in that summary, and also answer those discussion questions in the back of the book as well. All right, now we're in chapters 20 and 21. So look on page 547, benign versus malignant tumor. There just happens to be a really good table there, table 20.2 at the bottom of the right-hand side, characteristics of benign and malignant tumors. So you can see this when it's in a format like this, and you can kind of visualize this when you've got a question that says differentiate between the two. So it tells you that the cells in a benign tumor are similar to the normal cells, but in a malignant tumor, they're varied in the shape and the size, and they're very undifferentiated. In other words, they don't look like the other cells. And they don't act like them. They're non-functioning. Then look at growth. One grows slowly, one grows rapidly. How it's spread. One's localized, one metastasized into distant sites through blood and lymph. Systemic effects. Is it life-threatening? Yes or no? So look at that, but then I want you to go on farther to look at why is an expanding tumor mass complicated? What can it cause? In which areas especially? Why do we stage a malignant tumor? And you'll find that it's not grading, it's staging. Staging is on page, I'm almost there, page 552. The staging system describes the extent of the disease at the time and therefore provides a basis for treatment and prognosis. And it's based on, and look at those bullets. There's 3 things that you need to know there. And then go on to Hodgkin's lymphoma, page 217. What are the characteristics of that? Then let's go to chapter 21. Down syndrome, what is it? What causes it? Sex chromosomes, what are the characteristics of those? Who's XX, who's XY, how many are there? What is a multifactorial congenital disorder? Explain that and give an example. Recessive genes, look at page 571, autosomal recessive. How are they passed on to each pregnancy when both parents are carriers? Give an example of the type of disease that you would find that is spread in this way. All right, our last chapter, chapter 26, on page 612. Hans Seal has defined 3 stages of the stress response. Sometimes it's abbreviated GAS. So general adaptation syndrome, it's a concept, and you just need to kind of know what is maybe another name for it. What are the stages? The alarm stage, the resistant stage, and the stage of exhaustion. And then look at stress responses and perceptions of stress. How do they differ between individuals? Or what does it take for someone to perceive stress and respond to it? All right, that's it. So if you take this blueprint and complete it, you should have seen every question and answered every question that you're going to have on this exam. So there's 50 questions. It's going to be a lengthy blueprint, so get started on it early so that you have time to actually study and focus on the parts that are more difficult. And I look forward to seeing you all soon.